Hello and welcome to Sunset TV. I am Namrata Singh and you are watching Sarokar, where we bring you conversations that truly matter to you and to society. Epilepsy is one of the world's oldest known neurological disorder, yet even today it remains widely misunderstood. It is a chronic neurological condition caused by abnormal electric activity in the brain, leading to repeated seizures. According to the World Health Organization, nearly 50 million people worldwide live with epilepsy and 80% of them are in low and middle income countries. In India alone, more than 10 million people are estimated to be living with epilepsy. The encouraging fact is this: nearly 70% of the epilepsy cases can be effectively managed with timely diagnosis and proper treatment. And yet, despite medical advances, epilepsy continues to be surrounded by fear, stigma, myths and misinformation. Many families stay silent. Many symptoms are ignored. Many patients suffer not just physiologically but socially and emotionally as well. Awareness, early diagnosis and the right treatment can transform lives. So today, to help us understand epilepsy better, what it is, why it happens, how it treated and how society must respond, we're joined by two distinguished experts. I'm delighted to welcome Dr. Manjari Tripathi, Professor and HOD, Neurology, AIIMS, Delhi. I'm also pleased to welcome Dr. Atmaram Bansal, Webmaster, Indian Epilepsy Association and Director, Epilepsy Program, Medanta, Gurugram. Thank you to both of you and welcome to Sunset TV.
A pleasure.
Dr. Manjari Tripathi, I would like to begin with you, ma'am. This is a very important issue. And so I would like to begin with the basic question: what is epilepsy and how common is this condition?
So, epilepsy is a disease of the brain. Now, the brain has millions of tiny cells which are known as neurons. Now, these neurons normally are required for the normal function, moving the hands, speaking. But sometimes these neurons fire excessively and recurrently for few minutes, and this is somewhat like an electrical short circuit. So there's an electrical short circuit in the brain during which the patient can become unconscious, fall to the ground and have movement of all the limbs, which is the big seizure, or the patient can do minor activities like the head and eyes can go to one side, or they can be smacking of the lips, or they can become blank for few seconds, which are the smaller seizures. So basically it consists of these seizures which are unprovoked. They are not provoked by any acute situation like the sugar going down or the sodium going down. They are unprovoked seizures. Two or more of them is known as epilepsy.
Okay. Dr. Bansal, one of the biggest challenge with epilepsy is that, it often goes unrecognized and symptoms are often dismissed or misinterpreted, with maybe faint, and sometimes, maybe the person is exhausted or weak. So what are the common symptoms people should watch out for?
So, as you know that during school assembly and all, people used to fall in, there is a hot sun or something like that.
Right.
So, differentiation between seizure and seizure-like symptom is important. So, the epileptic seizures usually present one which madam said, that jerking kind of movement, one side jerking, looking like statue kind of thing, not able to talk to the next by person, and kind of unconscious for few seconds, confused, kind of staring look. These are some of the symptoms.
Okay.
Versus fainting, where there is just fainting and within few seconds the person gets up.
Okay.
Here the seizures, even if the consciousness is relatively prolonged, and when the person is recovering, still patient is not normal, the person is still confused.
Okay.
While in normal fainting, they just fell
Faint.
down and then immediately get
Right.
up.
Right. So, but so all seizures are not epilepsy?
No, definitely all seizures are not epilepsy. So, seizure, as I told you, is just a symptom.
Okay.
And the seizure commonly can be provoked or triggered by an acute insult. So, if for example, somebody has low blood sugar, they can have a seizure. They have low sodium, particularly elderly, they can have a seizure. Sometimes there are certain medicines like fluoroquinolone antibiotics. Okay, if we take them, we can have a seizure.
Okay.
Sometimes there can be fever, and within 24 hours of the fever, there can be a seizure. Sometimes there can be an acute infection in the brain like meningitis, encephalitis,
Right.
and within 24 hours to 7 days there can be a seizure. There can be a stroke. So the person has a stroke today, and today or within 1 week he has a seizure. Head injury, if the patient has a head injury, and the seizure can occur immediately or within 1 week. So any provocation which causes a seizure within 1 week of that provocation is what is known as a provoked seizure, as it's otherwise known as an acute symptomatic seizure. This is not epilepsy.
Okay.
Okay, this does not require long duration of treatment. It's usually for few weeks to few months.
Yeah, that's good to know, ma'am, because otherwise there is a lot of confusion between seizures and epilepsy. And ma'am, what are the main types of epilepsies, if you could tell our viewers?
So, epilepsies are simply divided into 3 major categories.
Right.
The first is a focal. Okay, so focal can be of 2 types. Focal with intact consciousness or focal with impaired consciousness. So, focal with impaired consciousness means I go like this, okay, to one side, and anybody who's asking me anything, I don't respond and I don't remember.
Okay.
So that's impaired consciousness. But if I have jerking like this, and I'm fully aware that my hand and leg are jerking, my face is also jerking, I'm fully aware of it, then it's a focal with preserved consciousness.
Okay.
This focal, starting on one side, can go to both sides. So it is focal becoming generalized. It can be generalized seizures or generalized epilepsy, where the seizures are right from the beginning in both the hands or both the limbs become stiff.
Okay.
So generalized tonic-clonic, generalized tonic, they can just fall to the ground, atonic. So these are the kinds of generalized seizures. They are coming from the, or epilepsy which is coming from the whole of the brain.
Okay.
So very often generalized seizures have a genetic underpinning. Now genetic does not mean it is inherited.
Okay.
This is a common misperception in our country that jahan doctor ne bola genetic epilepsy hai, people start stigmatizing the mother and the child, saying ki iske genes mein thi to isko ho gaya. No.
Right.
Genetic just means there is a problem in the gene. Genetic is not the same as inherited.
Okay.
Yeah.
Okay. Dr. Bansal, so what typically triggers an episode of epilepsy?
So one is like madam told, the provoked one. Other is like I have epilepsy. What are the triggering factor for which I can get seizure? So commonest one is missing the dose of medicine.
Okay.
The second is not sleeping properly. Third is then suppose you take alcohol or some substance abuse. So these are commonest trigger factor for a person with epilepsy where seizure can get provoked. So it's important for a person to take medicines very, very regularly, sleep at least 7-8 hours and avoid any kind of substance abuse.
Following a lifestyle, basically, better, healthy lifestyle.
A healthy lifestyle.
Right, right. Dr. Tripathi, you know, we often hear that epilepsy can affect people of any age, even children and infants. So tell us more about pediatric epilepsy, and can it begin before birth?
Yeah. So anybody who has a brain, and presumably all humans have brains, can have a seizure and hence have epilepsy. And it can come right from the first day of birth.
Okay.
In fact, there are documented intrauterine seizures also, where the mother will experience very vigorous movements.
Okay.
Normally the child moves slowly, but here there will be, rigorous movements within the womb.
Oh.
So intrauterine seizures are also known, though they are not so common. First day of birth, third day of birth, fifth day of birth, okay, all they can have seizures, some of which can be epilepsy and some of which may be acute symptomatic seizures.
All right.
Yeah. So the causes are different. Okay, in a child who's just born, it could be due to low oxygen during birth, or some neonatal meningitis, encephalitis, or it could be due to an intraventricular bleed, which is very common in children, or it could be due to a genetic cause.
Okay.
Some genetic epilepsies will come within the first 1 month. Or it could be due to a genetic malformation of the brain. One side, the brain itself is not formed well. So those are the causes usually in very young infants and children. In older children in our country, again, infections are very common. Head injury is also very common. In villages, we find the children are playing kite or playing on the rooftop, and these rooftops do not have a railing or a barricade.
Right.
So they fall off the roof, and then immediately they may be unconscious, but after 3 months or 4 months they start having seizures and epilepsy. It's a very common cause in our country. Riding without helmets, you know, anybody, any age, riding without a helmet, meeting with an accident. So the accident may happen in March, but the epilepsy may start in December following that head injury. So post head injury is so common in our country.
Okay.
Other cause in our country, which thankfully due to Swachh Bharat Abhiyan of the Prime Minister ji has come down, which is neurocysticercosis.
Okay.
So this used to be due to poor food and water hygiene.
Okay.
So if the food, particularly the greens, are not washed well, you know, the tapeworm is there, infestation is there with us, as well as there's porcine tapeworm. So these tapeworm eggs are shed into the fields by humans when they were using fields, or by the porcine, you know, pigs. Now these eggs then find their way and attach themselves. The eggs, they are microscopic, you can't see them.
Okay.
They attach themselves to the leaves.
So even if we clean it properly, like then also.
So what happens is, what they advise is that you have to wash the green vegetables, like cabbage hai. Cabbage ka jo bahar ka hai, that you have to rub and wash it in running water.
Okay.
Not stagnant water. Not hotel style. I don't know if you visited hotels. In hotels they keep a bucket. Many roadside eateries. And in that bucket they are washing all the vegetables. And that water itself will be muddy.
Right.
So it has to be in running water, and it has to be hand rubbed. Particularly if you're eating raw salads. And raw salads go in burgers, lettuce, momos. You know, so if you're eating raw, you have to be very careful, because these eggs will not die. They die only if they're heated, extremes of temperature. So anything which is boiled for beyond 10 minutes, they would be dead.
Okay.
But salads, momos, dhania chutney, you know, you are not going to heat it.
Right.
So that's how you get it into your stomach. And from the stomach, it goes to the brain. Once it goes to the brain, it has no escape. It solidifies there, it has various stages, and it leaves a calcification, like a chalk piece inside your brain. And that can cause seizures any time in your life. So now we are finding fewer cases because people are using toilets, but really the hand hygiene also needs to improve. After using the toilet, you need to be washing your hands. Many people may not be doing so, may not have access to potable or clean water. So this is very important to prevent this very important cause.
So hygiene should be maintained. Dr. Bansal, good news is that epilepsy is treatable.
Yeah.
So what are the usual treatment options available in India today, and how affordable are these medicines?
See, fortunately, we have almost all the best medications which are available in the world also. The newer medications, the older medications. And some of them are very, very cheap, something like costing 1 rupees or 2 rupees a day.
Right.
So the cost factor, at least in most of these medicine, in common epilepsies, is not a big factor. But in certain cases, yes, if they are quite complicated, if you need to give more than one medicine, in that case, cost can be a factor. But commonly, like 60-70% patient get improvement with maybe even one medicine or just two medicine, and maybe we are able to stop medicine after 2-3 years. So then cost factor may not be a big factor for those patients.
Okay.
But for patients who are not getting controlled, then adding new medicine, adding newer medication, the costly medications, or going towards something like surgery, then the cost factor comes quite significantly.
So surgery can make it better?
Surgery can make it better, and fortunately we do have many centers. Madam is leading a very good high number centers in epilepsy surgery.
Right.
So epilepsy surgery is quite useful in patients where the seizures are not getting controlled at all, and we do find a single point or particular point in the brain that was producing that sparking. We remove that point and patient can become seizure free.
Dr. Tripathi, tell us more about this.
So, you know, normally we start with one medicine and we increase the dose to full dose, and the seizures continue despite the patient taking the medicine. Then we add the second medicine and we make that also full dose. Now patient is on 2 medicines but still continuing to seize. The chance of the patient becoming seizure free on the 3rd medicine is only 5%.
Okay.
So once we find that the patient is not responding to good tolerated doses of 2 medicines, provided he is taking them daily, we call these patients as having drug-resistant epilepsy.
Oh.
And hence these drug-resistant epilepsy patients are now not to be managed in the periphery, in the PHC, district hospital. They have to be referred to centers which are equipped with evaluation of these patients. So the evaluation includes, detailed history, video recordings, EEG recordings, video EEG, MRI. The MRI for epilepsy protocol for drug-resistant epilepsy takes 1 hour.
Oh.
The patient has to have 1 millimeter sections of the brain. It is so fine that it picks up the minutest problem. So 1 hour MRI. And sometimes even these don't answer, and we do PET, we do SPECT, we do MEG. And then we have a team meeting where the whole team members sit down. Neurosurgeon, neurologist, neuroradiologist, nuclear medicine, dietitian, nurse, everybody sit down, neuropsychologist, and we discuss the patient. If the patient's seizures are coming, say from one point over here, then the cure is surgery. Then the cure is not medicines, or the control is not medicines. And the more you delay it, the more they lose out on their life. So people are coming still to us with 20 years of drug resistance, with 15 years of drug resistance. And what do we need? 2 years, even less than 2 years.
Less than 2 years.
In children, less than 2 years, we need to operate. So within 2 years, these people should reach centers which are there in our country. And the equipment is there in our country. We are very advanced in terms
And
of...
surgeries are successful.
Absolutely, they're very successful.
Okay. Dr. Bansal, patient is diagnosed with epilepsy. How often should they be in touch with the doctor, and can they go and live a normal life?
That's very important. What happens, like you consult a doctor, the doctor is prescribing medicine. You take medicine, you are doing well. As a normal human tendency, after few days, few months, you feel that you are doing well, why to go to the doctor? Why to take medicine? And they stop medicine. So that creates a lot of problem. So it's not that you need to go to the doctor daily or weekly or monthly. Depending upon your type of epilepsy, 3 months, 6 months, or even after 1 year you can consult. But the duration of treatment, let the doctor decide. Don't stop by yourself.
Like people have started taking antibiotics on their own.
Yes, so that has led to antibiotic resistance.
Right.
So similarly, if you take anti-seizure medicine on your own, someday you are not taking, someday you are taking half dose, that creates problem.
Okay.
So better to consult before reducing dose, before stopping the medicine.
Absolutely. Dr. Tripathi, a seizure can be frightening to witness, So can seizures ever become life-threatening?
Absolutely. So there is a huge impact of every seizure. Now there is something which we realized very late when we found that patients with epilepsy are not coming back for follow-up. And you call up their home and they say the patient is no more. So there is something known as sudden unexpected death in epilepsy, which is known as SUDEP. Now 1 in 1,000 people with epilepsy can have a SUDEP. They can die suddenly during a seizure or in sleep if they have a seizure. And if it is drug resistant, then it is 1 in 100. Okay. The other danger of having seizures, just last week I saw a girl whose mother had gone to the toilet, and the girl goes to the stove and she fell over the stove and she's burnt her whole face because she had a seizure there. So burns, injuries, fractures, dislocations, getting handicapped, one hand being cut off. In the village you have those saws which cut the जो धान को काटते हैं.
Right.
So the fellow had a seizure while he was cutting it and his hand was chopped off. So because you're unconscious at that time. So there are all these impacts which are physical impacts apart from the mental and emotional impacts which every seizure has. So every seizure holds certain amount of risk.
Right.
Yeah.
Right. Dr. Bansal, can it be prevented? Can epilepsy be prevented? And what care should be taken by the people around them?
So one is preventing just before coming. So that is like a disciplined life, like mentioned about that Swachh Bharat Abhiyan, that open defecation used to get the neurocysticercosis and worms. So like having hand hygiene. So this prevents infective etiologies.
Okay.
But somebody already having seizure and how to prevent the recurrence. So for that the important part is, one is taking medicine very, very regularly.
Okay.
Sleeping adequately, avoiding any kind of substance abuse, consult your doctor regularly, and don't play with your medicine. Don't do experiment with your medicine, which is a tendency for the common man. So that should be avoided.
This question is for both of you. We have seen there are a lot of stigma, fear, misconceptions, myths attached with epilepsy. So, ma'am, to begin with you, what are the myths and misinformation regarding epilepsy, according to you?
I think the biggest problem we face now is that people think that if somebody has epilepsy, their children will have epilepsy. This is wrong. It's a misconception. The second is that they think that there is something known as a course for epilepsy. Okay. That is, 2 साल लेंगे, उसके बाद बंद कर देंगे. So it's not like that. Every cause of epilepsy has a different treatment, trajectory or a plan. Some people with epilepsy have to take it for very long. Some people have to take it for 2 to 5 years. Some people have to take it for very short. So there is nothing such as a fixed course for epilepsy. Then the third thing is, if a patient is having a seizure, then you should make them smell a shoe or an onion.
Right.
Now this is completely wrong, because every big seizure, 98% of big seizures will stop on their own in 2 minutes. By the time the house member is getting the shoe and onion, the seizure has stopped. So this is the biggest myth. Okay. Then of course they think कि शादी कर दोगे तो मिर्गी बंद हो जाएगी. So you'll often find, that these teenagers who are becoming of marriageable age, their parents will come, अभी इसकी शादी कर दें, अभी इसकी शादी कर दें. We ask why. So ठीक हो जाएगा शादी को. So this is a very common misconception कि ये brain में इसके हलचल हो रहा है, अगर शादी करेगा शांत हो जाएगा brain और नहीं होगा कुछ. So this is also wrong. It's not something to do with the mind. It is something to do with the brain.
लोगों को लगता है कि supernatural है.
हाँ, बिल्कुल. So this is another thing कि ये भूत प्रेत है या छुआछूत है या बाहर की हवा लग गई है. Misconception stems from lack of knowledge. Right. If every school child is educated what epilepsy is, this will not happen. So it is basically the lack of knowledge which is creating, and lack of education which is creating these misconceptions.
Right. Dr. Bansal, what according to you?
So another point was whether they can live a normal life.
Right.
So what happens, like if somebody is having epilepsy, the parents are very much worried whether the kid can play, whether the kid can study or not, whether he will be able to live a normal life or not. Majority of the cases, when the seizures are controlled, they can live a normal life. They can do job whatever they want. Most of the cases, like jobs they can do, except that those hazardous jobs or mechanical jobs. They can easily live a normal life, can get married, can have kids, and the kids can be absolutely normal.
A person with epilepsy is out of action for 5 to 10 minutes.
Right. Right.
It's
So it's common.
It's common. It's common, and it is to be accepted as part of having a brain and its mischief. It's got nothing to do with that person being deranged or that person being bad or whatever, doing something bad in his past. It is just a simple disorder which we need to empathize with and give care to.
So basically it's a medical condition, not some bad karma or something like that.
We do have doctors, engineers, advocates, businessmen, big leaders and all. They have epilepsy and they are doing very well. And they are like at the top of their career.
In fact, there are studies which say that people with epilepsy are more creative. They are also very intelligent, provided they are given that support from the community.
Right. Dr. Tripathi, finally, I would like both of you to share one important message for the viewers who are watching our show.
From my side, I would say that if you see anybody who is having a convulsion, please just turn them to the side and just time the seizure. If there's a tight button, just loosen it. And if the seizure lasts for more than 5 minutes, you need to take them to the hospital. But 98% of the times, the big seizure finishes in 2 minutes. Sometimes doctors prescribe a medicine which can be given through the nose that can be used.
Okay, Dr. Bans.
Yeah, so I'll add on that if somebody is getting seizures, what people do, they put spoon, they put finger in the mouth, try to put water, don't do anything. Until unless the person is conscious, don't give anything by mouth, whether it is your spoon, whether it is water, whether it is finger. Because if you give water during that unconsciousness, the water can go into lungs and that can do more harm.
Right.
So turn that person to one side, let the person become conscious, then only give something.
Okay. So basically awareness is the key.
Yeah.
Absolutely.
And the people do try to hold that person. 2-3 people will try to hold the arms and legs.
Right.
Don't hold it. Let the jerks happen. Within 1 or 2 minutes that will be over. And then you turn to one side and wait for the consciousness. Then only you give something.
Absolutely. So, as our guests have suggested, that there are still many myths and misconceptions surrounding epilepsy, which is why creating awareness about the condition and its treatment is so important. I think the message from our guests clearly states epilepsy is manageable and it should not stop anyone from living a full and meaningful life. So, thank you so much, both of you, for sharing your insights and coming on Sunset TV. And to you viewers, thank you for watching. Stay tuned and keep watching Sunset TV. To watch more programs of Sunset TV, subscribe to our YouTube channel and don't forget to like and share them.